Pittsburgh area might be the worst hotspot in Pennsylvania right now, but experts warn the Philadelphia area is not far behind.
Joining us now is Dr. David Rubin. He's director of PolicyLab at Children's Hospital of Philadelphia. Dr. Rubin, thanks for being here this afternoon.
Thanks for having me.
So the lab has come up with its own model, and this is disturbing. It's forecasting a surge in cases for this area. Can you explain what's behind that?
Yeah, our attention obviously has been to Western Pennsylvania recently with really the worsening situation that's coming out of Ohio. The whole region is feeling a lot of pressure from the west, and we've seen obviously significant outbreaks in Pittsburgh. But our eyes have been trained on what's quickly evolving into a much more serious situation now along the Mid-Atlantic and moving up the Northeast coast. Over the last couple of weeks, we've watched the D.C. area and the Baltimore area very quickly deteriorate in terms of their forecast. They look now more like North Carolina, which has been having a lot of problems, than they do like us. And in the last couple of weeks, we're starting to see the same patterns that had emerged to the south of us now emerging throughout the Philadelphia region. It's not just in Philadelphia, which we're now seeing increased cases. We're seeing it in all the collar counties on the Philadelphia side, as well as in southern Jersey. And so it's a very concerning situation. And look, we have 6 weeks left before Labor Day, and we're trying really hard to get our kids back to school. But the public needs to have confidence that we've actually degraded our case counts enough for families to feel safe, for teachers to feel safe. And now is the time to really understand that we're not going to wait for it to crash down before we start to try to resolve this. Now is an opportunity to try to think about the sacrifices that need to be made if we are trying to get back on track before Labor Day.
You know, you were part of the governor's announcement yesterday where he placed some new restrictions on bars, restaurants, nightclubs. Why is that a good approach to take here?
Well, they're actually, many people don't know that the coronavirus task force has been sharing plans with states to really try to get control of this epidemic again. And they're I think they're smarter plans right now. I mean, certainly there are sacrifices, and we don't want to minimize them. But that said, I think, rather than foresee a complete lockdown or shelter-in-place strategy, these mitigation strategies are trying to target the areas where we've seen increased transmission, where we've seen problems with gathering size, people accumulating in indoor spaces. They don't shut down bars completely. I mean, bars are still open to outdoor service, as far as I understand, as well as dining outdoors. And many other retail stores still are still allowing entry, and hair salons as well too. So I think we're trying to get smarter about how we respond to crises like this. This has been my opinion. I didn't draft these recommendations, but they're also now being supported by recommendations coming out of the task force as well too.
So we're moving, of course, closer to the start of the school year, right? You're also watching how this could impact the reopening of schools. What are some of the factors that are of concern right now with that?
Well, it doesn't matter what our elected officials are going to do. The public the public wants to feel safe. Our teachers want to feel safe. Children don't live in a vacuum. We know that children have lower risk. It's not zero. We also know that kids can transmit, maybe not as much as adults, but they rely on parents in their lives and grandparents in their lives, the teachers around them, and building a successful economy for the fall starts with making sure our kids can get back to school safely. And if we don't get our transmitter control, it would help to have more national standards. And my worry is, despite the noble efforts of people in Pennsylvania and the authorities here and up and down the Northeast, because the New York area is going to see the next wave as well too, that we could have that honest conversation as a country of trying to agree upon some things we all should be doing to try to protect each other and try to restore confidence in reaching Labor Day and getting some more schools open.
Right, we got to get those numbers down. Dr. David Rubin, director of PolicyLab at Children's Hospital of Philadelphia. Thank you so much for your insight today. All right, ahead on NBC.